Good day, ma'am, sir. Today, I'll be reporting the topic that I chose, improvement of diagnostic accuracy for pancreatic cancer with serum lactate dehydrogenase or LDH. Hello, by the way, I am Hilbert M. Aguila. I am a medical technology student at USI. But first, let us define pancreatic cancer. Pancreatic cancer, or PC, is considered the most lethal commonly occurring cancer. Pancreatic cancer, or PC, is a disease in which malignant cancer cells form in the tissues of the pancreas. Pancreatic cancer is difficult to diagnose early. At the time of diagnosis, nearly 80% of the PC patients have already reached an advanced disease stage. Tests that examine the pancreas are used to diagnose the stage of the pancreatic cancer. Introduction. It is the worst of all cancer maladies, 10th most commonly diagnosed cancer in the USA, 4th most common cause of all cancer-related deaths. The 5-year survival rate of PC patients is the lowest for all cancer types, at approximately 9% only. Currently, the diagnosis of pancreatic cancer is hugely dependent on tumor biomarkers, CA19-19, CEA, and imaging features. CA19-19 or carbohydrate antigen 1919 has satisfactory specificity for differentiating benign and malignant pancreatic tumors. CA1919 has poor sensitivity and can also be elevated in hepatobiliary cancers and benign biliary obstruction. Each imaging modality has different advantages and disadvantages, which can require costly equipment and specialists. Histological diagnosis requires invasive operations like biopsy obtained by endoscopic ultrasonography, guided fine needle aspiration, or EUS-FNA. Currently, accurate diagnosis of PC patients based on radiological features and CA19-19 has thus far been unsatisfactory. Discussion. CA19-19 is the only marker that has been approved by the United States FDA for use in the routine management of pancreatic cancer. Serum LDH levels of patients with PC were higher than those with PBD and HBE. It has been proven in the study that LDH plus common tumor biomarkers such as CA19-19 and CAA results to improve diagnostic accuracy. Carbohydrate antigen 1919 is used for routine management of pancreatic cancer. Carcinoembryonic antigen can supplement CA19-19 with specificity of 84%. CA125 combined with CA19-19 can increase specificity and sensitivity of PC prognosis. Mucin family such as MUC1, MUC4, glycopan, fibroblasts, complement C3, complement C4, and a polyproprotein could be used as indicators for PC diagnosis, prognosis, prediction, and recurrence monitoring. LDH has been suggested as a potential diagnostic biomarker for malignant tumors, breast cancer, gynecological cancer, non-Hodgkin lymphoma, lung cancer, esophageal squamous cell cancer patients. Unfortunately, most of them remain in the experimental stage due to the complexity of the detection or the lack of internationally standard cutoff points. LDH is composed of two subunits, LDHB, the heart type H subunit, and LDHA, the muscle type M subunit. LDHA is found in skeletal muscle, which converts pyruvate to lactic acid. The amount of LDHA in human tumor cells is higher compared to abnormal ones. Overexpression was detected throughout the tumor process in nearly all cell lines tested, may have a marked adverse influence to patient survival. Warburg effect: glycolysis is more active in tumor cells than in normal cells. Knockdown of LDH gene can attenuate to glycolysis and inhibit tumor cell progression. To settle everything in the discussion, when LDH was combined with common biomarkers such as CA19-19 and CAA, the specificity for PC diagnosis significantly increased to 96.7% and the sensitivity increased to 87.6%. Furthermore, their results demonstrated that serum LDH levels could act as useful predictor of estimated survival of the patients. Literature review: serum LDH predicts prognosis and correlates with a systemic inflammatory response in patients with advanced pancreatic cancer after gemcitabine-based chemotherapy. This research was conducted by Xu Linyu et al. They correlated serum dehydrogenase with tumor progression and poor outcomes. They evaluated the predictive value of serum LDH levels for overall survival of patients with advanced pancreatic cancer after gemcitabine-based chemotherapy. They retrospectively enrolled 364 patients with locally advanced metastatic pancreatic adenocarcinoma who were then allocated to training and validating cohorts. They concluded that serum LDH levels were associated with a systemic inflammatory response and served as significant prognostic predictor of overall survival of the patients. Serum LDH levels predicted overall survival in patients with advanced pancreatic cancer after gemcitabine-based palliative chemotherapy. In conclusion, serum LDH levels were higher in PC patients than in PBD patients and HPE individuals. The test combining LDH, carcinoembryonic antigen, and carbohydrate antigen 1919 had higher sensitivity and specificity, which may improve the diagnostic of pancreatic cancer. For references, please visit doi.org/10.2147/cmar.s31231. Thank you for listening and stay safe.